structure, not in this patient since this is perfectly normal, but
that's exactly.
We use the transesophageal procedure for looking at this structure, don't we?
That's exactly right. I mean, this structure on the right there is a little bit of a crescent structure, and actually that aortic valve is back there on your left again, and that crescent structure is actually called the left atrial appendage, and you cannot see that structure from a regular echocardiogram from the outside of the body. And it becomes important because a lot of people have a rhythm called atrial fibrillation. And when people have a rhythm called atrial fibrillation, you can see how that little crescent structure seems to squeeze and go in and out. It's normal with this patient, but in patients with atrial fibrillation, it becomes kind of where it flutters. It doesn't squeeze well, and it's a place where blood can actually pool. And the problem with that is if you form a blood clot in there, the first place it's going to go if it gets dislodged is up to the brain, typically a stroke. Could also, though, go to the upper extremities or lower extremities. So a lot of times we use this procedure in patients who have atrial fibrillation. We may not know how long they've been in it. We get them started on some blood thinner, then do this procedure and look and see. And if there's no evidence of a blood clot in this structure, then it's actually safe at that point to do a procedure called a cardioversion, where we actually shock their heart back into a normal rhythm. So very useful procedure for looking for patients to have clots in their heart before we shock their heart back into rhythm. And again, the only way you can see this structure is basically with the procedure we're doing tonight, Bill.
Right. And then if they do have, or even if they don't have clots with atrial fibrillation, we recommend usually Coumadin or warfarin for further anticoagulation, at least for a short time. Isn't that
Absolutely.
right? In certain patients, even a lifetime, because of the risk of stroke. One of the most common causes of stroke, especially in the older patient, is atrial fibrillation with a clot forming in that left atrial appendage where Jeff just pointed out, clot getting loose and then going to the brain, and also can go to other parts of the body, also like the legs, and cause trouble there. So it's a really important finding, and this is by far the best way to see it, and we're getting beautiful views of this structure tonight.
I think now we're kind of in what we would typically call a 5-chamber view, which I think is good to see. On the right, on the bottom, is actually the left ventricle again, with the mitral valve up there on the right in the middle, and above that is the left atrium. On the bottom left is the right ventricle, the tricuspid valve, and then the right atrium above that. And every once in a while, you'll see the aortic valve come into play there as well, too. And this is very nice images, so you can
beautiful.
See the whole thing. We're going to now put some color over here on the right side of the heart, the tricuspid valve. And
this is a part that goes to the lungs, is that right?
That's exactly right. So blood flow's coming down through that top chamber on the left, through that tricuspid valve that we got some color going across now, and goes into the bottom chamber on the right. From there goes to the lungs and comes back into that top chamber over on the right, through that mitral valve, down into the left ventricle, always called the pumping chamber somewhat of the heart. And blood flow goes then out through that aortic valve that we saw earlier, has 2 cusps, and that's how you get oxygenated blood flow to the rest of your body.
And sometimes we have some little holes in the heart.
We do.
Especially up there in the atrium.
We do. So right now, don't see a lot of tricuspid regurgitation or leakage going back through that tricuspid valve.
Right.
The structure in the middle up top that divides the left atrium and the right atrium, you'll see it right in the dead center of the screen. Color's kind of going across there. And that actually is an area where holes can be. And actually, when you're not born yet, you have a hole that's naturally there called a patent foramen ovale. And that's because you don't need oxygenation from outside. You get oxygen from your mom. And so basically what we do with that is after you're born, a lot of people that will close. Some people it partially closes. Some people it never closes. The people that it closes sometimes can open up. But it's an important structure. We always look on transesophageal echocardiogram because you potentially, if you have a hole there, it's a way to get a piece of plaque or something that would normally be filtered out through the lungs, to get that to go across, and actually, again, a way to cause a stroke. You have then potential blood clot or plaque that goes through that patent foramen ovale and goes up to the brain or goes to the extremities and cause a lot of problems. So, you know, another good thing to look for, if people are having recurrent strokes or mini strokes called TIAs, we can look at this area and see if there's any problems with basically a hole in the heart. And there are procedures that we can actually do here at Shawnee Mission where if it's big enough and people have had those symptoms, actually can close those up with a closure device, a device actually that's what we call percutaneous, so not a surgical procedure, but actually done through the leg, and patients can have it done and go home the next day. We're going to kind of keep looking at this.
Are we able to do a bubble study tonight or not?
Yeah, I absolutely am. I'm just going to look at another view here. And
Sure.
Again, that septum is up on top again. And what I'm going to do is put some color across there again. I just want to make sure you get really good images,
Right.
Make sure nothing's going across here.
This has been really helpful, the TEE for strokes, because we do find at times a neurologist asks us to do these procedures lots of times when they have patients with strokes because they're unsure of the cause. And again, As we talked about, clots in the heart, especially the left atrial appendage, and also at times a hole in the heart, like a patent foramen valley, can be a specific cause that they know about then and can treat accordingly, either with medications or a closure device or whatever. So this procedure is really helpful to the neurologist.
That's absolutely right. What we're going to do now, Bill, is what you were talking about a minute ago. We're going to agitate some saline, so some bubbles, and actually inject this through an IV. This will come into the heart on the right side through the vena cava over there on your right. The top structure up there at the very top corner of the screen is the septum again, and what we're looking for is any bubbles that go across there. I'm going to find a right position that I kind of like personally.
And what he's doing, this is just salt water or saline, which we use in the hospital all the time, and you just shake it up. It's not a lot of extra bubbles thrown in there. It's just bubbles that are already dissolved, their oxygen already dissolved in the saline, which is normal. Shake it up, and then these little what we call micro bubbles, which you can't even see with the bare eye, but with the sonogram, the sound waves bounce off these little bubbles, and as you're going to see, you're going to be seeing sort of like a snowstorm of little bubbles. And again, these are not bubbles that are big enough to see. These are micro bubbles, but they show up very well with sonography because the sound waves bounce off of them.
That's exactly right. We're going to go ahead and do that part now. So go ahead and inject there, Shelley, and we'll get some images. You'll see the bottom part there fill up with a lot of white structures. Those are the contrast to the bubbles. And we want to make sure that they don't go into the other side. A few may go into the other side after about 7 or 8 beats, and that's kind of normal. I can tell you right now in this one that there is no evidence of a patent foramen valley. It's a great study, and there is no evidence of anything going across there at all.
It really outlines all the structures, and you can see that where the bubbles are is where the blood is. So you can just picture in your mind now where the blood is flowing through. It's flowing through where those bubbles are. The bubbles are mixed in with the blood. So the dark areas in these echoes are actually areas filled with blood, the inside of the heart chambers.
That's exactly right. I think that's a great point, too. The bubbles can kind of direct you on how flow is going a little bit through the heart. One other structure I wanted to look at down here before we move to a little different area. You might give her a little bit more Versed and Fit. No. We're going to look at the pulmonic valve down here in the bottom of your screen on the right. A little bit hard structure to see, but you can see it down there. We just got a little bit more bubbles in there because we gave her a little bit more medicine, try and keep this young lady comfortable. We're going to put some color down here. Jessica is, and she's going to kind of show you where that pulmonic valve is down there. We'll see if there's anything going across there. Typically, a lot of patients, and younger patients typically have some pulmonic valve insufficiency down here, but, don't really see a lot. The bubbles obscure our view a little bit with this right now, but really don't see a lot.
Looks like a pulmonary artery is good, pulmonary outflow tract.
I would agree. It does not look dilated or enlarged at all. I think that's a great point again.
We're really not finding too much other than a abnormal valve, are we?
I think that's exactly right. I think, to me, you can take me off color.
That was, you'd call that a congenital valve or
it is.
Born with it?
It looks like a bicuspid valve that's congenital. Born with it is what that means. And actually, aortic valve, bicuspid valve is the most common congenital anomaly we find that people are born with. Very common. And so not too unusual to see that here.
So with TEEs, we really do, what we're trying to do is study patients that have specific structural problems that we can't see possibly as well as we should through the chest or through the transthoracic approach. And we also look for complex abnormalities that we might not be able to figure out otherwise. Injecting bubbles, for instance, like we just did here, to see what the blood flow is like and where it goes, that define structures better than the standard echo would be, and then also look for blood clots and other sources for stroke and other neurological problems.
That's exactly right. And if you notice, I've actually gone to a little different position here, and actually we're down in the stomach now. And the esophagus basically leads food down into your stomach, and I'm actually down in the stomach now, and what we're looking at is the heart from back up. There's a circular structure on your right, and actually that's that left ventricle again, pumping blood out to the rest of the body there. And to the left of that, on the other side, the dark space is actually the right ventricle. So function of the heart is absolutely really good with this young lady.
What if a patient has a heart attack? What would you see there, or has what we call coronary artery disease?
If somebody had a heart attack, or even sometimes in the midst of having not enough blood flow to that ventricle, we would see a wall of the heart, so where it's circular, and you notice everything moves in at the same time, everything contracts. And what we would see is potentially one of those areas not moving at all, maybe even bow out the opposite way when everything else comes in. So right now I'm going to go a little bit different view.
This is a very helpful test for us, or echocardiography is in general, maybe not so much the transesophageal, but the transthoracic, to see patients acutely in the emergency room. We can do a study,
Absolutely.
acutely look at their heart and get an idea if they're in